Neurology for 8th semester students of the Faculty of Medicine, Neurology. Neurology in the 8th semester is part of the medical curriculum that aims to provide an in-depth understanding of neurological disorders in humans, both acute and chronic. This subject covers various topics regarding the diagnosis, management, and treatment of nervous system diseases that can affect the central nervous system, the brain and spinal cord, and the peripheral nervous system. 1. Definition of neurology. Neurology is a branch of medicine that studies disorders of the nervous system, including the brain, spinal cord, peripheral nerves, and muscles. Neurology focuses on the diagnosis, management, and prevention of nervous system diseases, as well as providing appropriate therapy for these conditions. 2. Learning objectives of neurology in the 8th semester. In the 8th semester, medical students are expected to understand the basics of anatomy and physiology of the nervous system, master neurological examination techniques, including motor, sensory, and reflex nerve examinations, be able to diagnose neurological disorders through proper history taking and physical examination, understand various types of neurological diseases and the principles of their treatment, manage patients with acute and chronic neurological diseases and understand possible complications. 3. Main topics in neurology. 3.1. Anatomy and physiology of the nervous system. Central nervous system, CNS, the brain and spinal cord, and their functional divisions, e.g., motor cortex, sensory cortex, cerebellum, and brainstem. Peripheral nervous system, PNS, nerves outside the brain and spinal cord, including cranial and spinal nerves. 3.2. Neurological examination. Physical neurological examination includes consciousness assessment, motor nerve examination, muscle strength, muscle tone, voluntary movements, sensory nerve examination, vision, hearing, sensation, and reflex nerve examination, deep tendon reflexes, pathological reflexes, coordination and balance examination, Romberg test, gait tests to assess body alignment and balance. 3.3. Common neurological disorders. Stroke. Types of stroke. Ischemic stroke, due to blood vessel blockage, and hemorrhagic stroke, due to brain bleeding. Symptoms. Paralysis on one side of the body. Difficulty speaking. Confusion or loss of balance. Examination and diagnosis. CT or MRI scans of the brain to determine the type and location of the stroke. Management. Treatment with thrombolytics, for ischemic stroke, blood pressure regulation, antiplatelets, and post-stroke rehabilitation. Epilepsy. Types of seizures. Focal seizures, limited to one area of the brain, and generalized seizures, involving the entire brain. Symptoms. loss of consciousness, muscle spasms, and uncontrolled movements. Diagnosis: EEG examination to record electrical brain activity. Treatment: anticonvulsant medications, e.g., valproate, levetiracetam. Long-term management to prevent seizures. Parkinson's disease. Main symptoms: tremor, muscle rigidity, bradykinesia, slowness of movement, and postural instability. Pathophysiology: degeneration of dopaminergic cells in the substantia nigra of the brain causing motor disturbances. Treatment: dopaminergic therapy, levodopa, dopamine agonists, and physical therapy. Multiple sclerosis, MS, symptoms: loss of coordination, muscle weakness, vision problems, and sensory disturbances. Pathophysiology: inflammation and demyelination in the central nervous system, damaging the protective myelin sheath around nerves. Diagnosis: MRI of the brain to observe lesions due to demyelination. Management: corticosteroids to reduce inflammation and immunomodulatory treatments. Peripheral neuropathy. Symptoms: muscle weakness, loss of sensation, burning sensations, or tingling in the hands and feet. Causes: diabetes, alcoholism, viral infections, or vitamin deficiencies. Diagnosis: physical examination, nerve conduction tests, and laboratory tests. Management: treating underlying conditions. Symptom management and pain relief. Multiple system atrophy, MSA, symptoms: motor disturbances such as tremor, balance problems, and autonomic dysfunction. Diagnosis: clinical diagnosis and brain MRI. Management: symptomatic therapy, as MSA is a progressive and untreatable disease. 3.4. Degenerative neurological diseases, dementia, types, Alzheimer's disease, vascular dementia, and Lewy body dementia. Symptoms: memory loss, confusion, difficulty with language, and impaired cognitive function. Diagnosis: neuropsychological testing, brain MRI, and cognitive function evaluation. Treatment: medications that slow down nerve degeneration, such as acetylcholinesterase inhibitors, donepezil, and supportive therapy. 3.5. Importance in neurological rehabilitation. Post-stroke rehabilitation, physical therapy, occupational therapy, and speech therapy to improve motor function and communication. Chronic pain management. Management of neuropathic pain with medications like gabapentin or amitriptyline. 4. Practical training and clinical practice. Basic neurological examination. Students will be trained to perform neurological examinations systematically and accurately. Neurological case simulation. Students will learn to manage cases of neurological disorders through simulation and case discussions. Clinical rotation. Students will rotate through various neurology departments to gain hands-on experience in managing patients with neurological disorders. 5. Evaluation of learning. Theoretical examinations. Students will be tested on their knowledge of the basic principles of neurological diseases, pathophysiology, and treatment methods. Practical skills assessment. Students will be evaluated based on their ability to perform neurological examinations and manage neurological patients. Case discussions. Discussions on patients diagnosed with neurological diseases, including analysis of diagnosis, treatment options, and management plans. The subject of neurology in the 8th semester aims to equip students with the knowledge and skills to comprehensively handle patients with neurological disorders.